Hi, everybody. I'm Paula Ebben. We're wrapping up our three-part family focus series on maternal health from conception to 1 year out. The CDC says America's maternal death rate is on the rise. And today we're taking a closer look at how new moms can stay healthy in the postpartum period. Dr. Mallika Marshall joins us. And we know, doctor, that a third of maternal deaths occur at delivery or within 1 week. And another third occurs between 1 week to 1 year later. Why is that?
I think it's that last one, right? From 1 week to 1 year later. Most people don't think about having a pregnancy-related complication that far out. I mean, most of the time when it is during delivery, it's an obstetrical problem, severe bleeding, other complications.
It makes sense.
Right. But if it's been 2 or 3 weeks since you've had delivery, you can have other problems. You could still have infection. You could still have serious bleeding. You could actually develop a heart condition called cardiomyopathy. So there are some things that women need to continue to keep an eye out for even after a week postpartum.
Wow. And so the first thing for women to know is that they still need to be vigilant about their own health even after the baby's been delivered, even after a normal vaginal birth. But the warning signs are there warning signs you can look for to suggest that you really need to go get help?
Exactly. So most women are expected to come back for a postpartum appointment 6 weeks after delivery. A lot of women don't return. One, because they feel fine, or they don't feel like they have the time, or maybe they don't have the energy to do it. Some people feel like they can't afford it. But that appointment is really important for a couple of reasons. So if you're still having bleeding weeks out, you could have something called a retained placenta, which means they didn't get the full placenta out, and women have died hemorrhaging from that. If you have pelvic pain or fever, it could suggest that you still have an infection in your pelvic area. If you had a C-section and it's red and swollen and not healing properly, it could suggest that you have an infection of that site, which would be a problem. Swelling in the legs. You know, we always talk about blood clots in pregnant women and postpartum. So if you all of a sudden have a red, swollen, painful calf, you might have a blood clot in the leg. Shortness of breath could suggest that you've got a lung problem, that you could have a blood clot that's traveled to your lungs, or that you could have developed cardiomyopathy or heart failure after delivery. And then feelings of depression and hopelessness. We always talk about postpartum depression. Those symptoms can develop long after the baby has come out. So these are things that you need to be aware of and have checked out if you develop them, even 6 months after giving birth.
And even once you've delivered, you got to remember, if you're not in good health, you're not good to anybody.
That's right.
Beginning with your baby.
Nobody's going to blame you for getting a checkup.
Thank you, Dr. Mallika Marshall. And for more family-focused health stories, keep it right here with CBSBoston.com.